sana. Thank you very much, Dr. Mary Mwalimu, Honorable Dr. Michael Bato, Senior Ambassador of the United States of America to Tanzania, and your delegation, including CDC. I've seen my brother Mahesh and other U.S. agencies, Jessica and others, founding and board members of the African Academy for Public Health, Chief Executive Officer of the African Academy for Public Health. I would also like to recognize the presence of two members of Parliament, Honorable Agnes Marwa from Mara region and Honorable Mohammed Moni. They are representing Parliamentary Standing Committee for Health and HIV Affairs. I thought it is a good idea to come with them here. If I go to the Parliament with recommendations to reform or change policies, so it can be easily understood and passed by the Parliament of the United Republic of Tanzania. Thank you very much, honorable members of Parliament, for joining me this morning. Representative from Harvard Chan University, Heidelberg Institute for Global Health and the ARISE Network, representative of local and international research and academic institutions, government officials, chief executive officers, representatives from various local and international civil society organizations, invited guests, ladies and gentlemen, habari za asubuhi. First and foremost, I convey my heartfelt thanks to the African Academy for Public Health for inviting me to officiate this 5th annual symposium of the ARISE Network, and with the theme, Bridging the Gaps, Transforming Adolescent Health and Nutrition Research into Actionable Practice and Policy in Sub-Saharan Africa. Of course, over the years, I have been part of these scientific gatherings and witnessed their impact in advancing the health agenda in Tanzania, but also in other countries in Sub-Saharan Africa, through generating evidence and further translating into practices. I sincerely commend the effort of this organization under the leadership of Dr. Mary Mwalimu, Chief Executive Officer of the African Academy for Public Health, for the great work they are doing, not only in Tanzania, but also in other parts of the continent. Personally, I have been a good founder. I've been a good, I don't want to put, maybe an advocate of Dr. Mary Mwalimu, because she's one of the few women in Tanzania in the health sector who are doing a great job in our country. You can see her passion, her commitment to work and support the government of Tanzania in order to deliver better health outcomes for every person here in Tanzania. Hongera sana, Dr. Mary Mwalimu. You are doing a great job for our country. Ladies and gentlemen, before I proceed, allow me to welcome all delegates from outside Tanzania to Tanzania. This is your home. Karibuni sana. I've seen participants from Nigeria, South Africa. Karibuni sana. This is your home. Ladies and gentlemen, today as we gather here, this symposium serves as a platform for sharing and learning best practices among health stakeholders on addressing adolescent health and nutrition needs in sub-Saharan Africa. It has been a priority of the 6th phase government of the United Republic of Tanzania under the leadership of Her Excellency Dr. Samia Suluhu Hassan, the President of the United Republic of Tanzania, to improve health and well-being of adolescents, recognizing that they are the future generation of Tanzania. Here, I would like to emphasize that a child and adolescent health remains to be among the leading priorities of the government of the United Republic of Tanzania, the Ministry of Health, and a priority for me as a Minister of Health, as a mother, but also as a woman. According to the National Accelerated Action and Investment Agenda for Adolescent Health and Well-being, adolescents account for over 12 million of the total population of Tanzania. and this number is growing. I'm pleased to see that this symposium is in line with the pillars of our National Accelerated Action and Investment Agenda for Adolescent Health and Well-being. Ladies and gentlemen, adolescent period is a critical phase in human development, marked by unique health and nutritional needs. In Tanzania, this group faces a number of health-related challenges such as malnutrition, and here basically we are talking about undernutrition, micronutrient deficiencies, and overnutrition. Mental health issues such as depression, substance use, sexual and reproductive health issues, as shown in different health surveys, including our recently launched Tanzania Demographic and Health Survey, Malaria Indicator Survey of 2022, which was launched November last year by our president. Also, we have seen population-based HIV impact assessment and the Tanzania Mainland Global School-Based Student Health Survey. These research findings underscore the need of deliberate policies and health programs that address their unique challenges, and the government has been committed in making sure that this is achieved. While significant progress has been made in reducing the burden due to poor nutrition outcomes, such as stunting among under 5 from 34.7% in 2014 to 31.8% in 2022, anemia among women of reproductive age has also been decreased from 44.8% in 2015 to 42% in 2022, as well as decline in new HIV infections among general population, but also young people in Tanzania. Some challenges facing adolescents, such as mental health and substance abuse, need a renewed impetus to combat. Ladies and gentlemen, some diseases that were formerly known to affect the elderly population in Tanzania, for example, diabetes and hypertension, are now increasingly affecting young people. A recent research has indicated that in sub-Saharan Africa, there is an increase of between 0.2% to 25% in adolescents with elevated blood pressure. However, the World Health Organization has reported a 5-fold increase in type 1 diabetes among children and adolescents between years 2011 and 2021. Keeping this finding in mind, I would like to stress on the importance of advancing the health agenda among adolescents and young people to improve their overall health and well-being, raising a generation of health individuals with ability to think critically and excel academically, thereby contribute to the development of our nation. I call upon each one of us, policymakers, researchers, healthcare providers, parliamentarians, parents, community members, as well as young people to take this agenda forward. This achievement cannot be realized without collaboration with local and international stakeholders and development partners. Ladies and gentlemen, I'm aware that several studies have been conducted under this collaboration, and I'm pleased that relevant government bodies in Tanzania have participated. I've been informed that of such studies that the calcium supplementation clinical trial, whose results will be briefly presented by a research team today. I had an opportunity to meet some of the members of the research team. They briefed me about the outcome of the calcium supplementation clinical trial, and I was convinced. I hope you will also be convinced. But I know there are issues for developing countries like Tanzania, the cost-related issues, but we have to weigh the benefit of calcium supplement for pregnant women in Tanzania and the cost of not providing calcium supplement to pregnant women. So I look forward also to hear more about the outcome of this clinical trial which was conducted in Tanzania and India, and we will discuss whether we proceed with folic faithful supplements or we do both. Faithful and calcium, you are the researchers, we are just the political and policy makers. But when you tell us, if I'm going to save lives of hundreds of pregnant women in Tanzania, definitely the government of Tanzania will be ready to implement the recommendation provided from this research. I'm also pleased to note that we need more home-growing scientific evidence that can contribute to enhancing the performance of our health sector, and the collaboration shown here that involves various scientists and public health experts within and outside Tanzania is indeed recommended. I'm pleased to see participation of our government institutions such as Muhimbili University of Health and Social Sciences, University of Dodoma, some regional and district councils, Ifakara Health Institute, Management and Development for Health, as well as ZAFA from Zanzibar in this collaborative research work and training. We appreciate the cooperation of our international partners, including Harvard University, and then today I was very pleased to meet the Vice President of Harvard University, but also members of the CHAN, members of the board of CHAN, who are also here. Heidelberg Institute of Public Health and several other institutions represented here from the sub-Saharan Africa and Europe that continue to be committed to build capacity and conduct researches jointly with Tanzanians. Ladies and gentlemen, in line with the theme of this symposium, it remains equally important to exchange knowledge and evidence, have collective dialogues and collaborations among all key stakeholders in adolescent health. This will help the government during formulation of policies, as I have highlighted earlier, guidelines and service delivery. Through collaboration between the government, implementing partners, stakeholders, as well as community at large, all these processes will be achieved. Throughout our deliberations, let us remain focused on the practical implications of the research results presented here. Let us not merely discuss challenges, but also identify actionable strategies, forge partnership and collaboration, shape programs and policies that will create a lasting impact on adolescent health in Tanzania and our region. Ladies and gentlemen, lastly, I'm confident that the insights shared during this symposium will inspire innovative solutions and catalyze a transformative shift on how we approach adolescent health and nutrition, not only in Tanzania, but also other countries within the region. Together, let us pave the way for a healthier and more prosperous future for the youth in our region. With these remarks, once again, allow me to thank African Academy for Public Health for inviting me to be here. But also I'd like to thank you for your great support and collaboration with the government of Tanzania in order to deliver better health outcome for all Tanzanians. I would like to thank our development partners, including the US government, for their support to the government of Tanzania and other non-government organizations to deliver or to implement various interventions within the health sector, both targeting communicable and non-communicable diseases, but also those interventions addressing policy and change in legislation in Tanzania. Once again, thank you very much for listening, and I hereby declare this symposium official open. Asanteni sana kwa kunisikiliza. May God bless you. May God bless Tanzania. May God bless Africa. May God bless African Academy for Public Health. Thank you very much.